Assalamu alaikum, everyone. Thank you for joining today. Our webinar on COVID-19 medical practitioners response. It is the first of a series of webinars hosted by MPA under the title Informed, Prepared, Act. We'll start with talk with our guests, Dr. Umber Rind and Dr. Sema. Then we'll have guests and questions, and hopefully we'll wrap up. So we're looking for a run time of 15 minutes. A little bit about us. So MPA, Muslim Professionals Association, is an association that facilitates a network of professionals from diverse ranges of industries to build and enhance our capability to mentor, support, and network within the Muslim and the wider communities. We collaborate with a wide range of community groups to serve a wide platform. We develop a group of Muslim professionals who are aligned with a focus on advancing the community. We connect local professionals with an international landscapes, including collaboration with international groups. We also establish support networks within the community, making it easier to have conversations about career progression and changes. MPA also provides opportunities for skill development, like including CV writing, cover letter workshops, and negotiation skills. We understand the industry trends and support the Muslim community's focus on emerging industries. And finally, of course, we create events that are in the environment suitable for the Muslim community. Our plan for this year is a big one. We have started the webinar series titled Inform, Prepared, Act, and this is the first webinar. We'll have more webinars in the coming weeks, and actually we have one more next week about education. So keep checking your Facebook page for the updates. We also started a jobs portal that's now live on Facebook. So check our Facebook page and you can find the link to that one. And also we're working on the mentoring program and the professional networking support group that will help the Muslim professionals during the tough times as a result of the COVID-19. And just to give a brief of what we have done last year, so we hosted 15 events that included more than 450 members of our community. And our website is just shy of 52,000 visitors. So you can also check what our updates are on Facebook, Twitter, and Instagram at MPA Ost. If you want to contact us, you can email us at info@muslimprofessionals.com.au. You can join us at www.muslimprofessionals.com.au, or you can check our pages on the social media, Twitter, Facebook, and Instagram. Our guests for today are Dr. Umber Rind, who is a general practitioner working in Melbourne. She completed her MBBS at the University of Melbourne in medicine in 2003. She has worked in many hospitals in metropolitan and rural Victoria and New South Wales. She trained in the Women's Hospital for many years and completed her general practice training in 2014, getting her FRA CGP in 2012. Our other guest is Dr. Sema, who is a pediatric doctor who is currently working in a busy Victoria emergency department. She graduated from the University of Melbourne in 2015 and has since been working in the public hospital system. Her interests include increasing health literacy among women and children, and she's passionate about increasing access to health for children and all walks of life. So before we start our discussion, I'd like to acknowledge the traditional owners of the land on which we meet today. I'd like also to pay my respects to their elders, past and present. Dr. Sema and Dr. Umber, thank you for coming today, and thanks for your time in such busy environment. We know that the COVID-19 pandemic is causing a lot of stress and a lot of changes in your professional work. So Dr. Umber, can you talk about how the COVID-19 has changed your day-to-day operation and how that impacted you?
Yeah, so it's definitely had a very big impact on how we run the practice. Before telehealth was introduced, we had to start screening a lot of the phone calls. And the reason that was anyone with cold and flu symptoms, we didn't want them to be coming into the clinic. We wanted to try and keep them at home and then do an assessment that way. Another thing, we had to put a lot of signage around the clinic to prevent people who thought they had coronavirus from coming inside. We've had to establish a barrier, so a distance from the reception desk where the patients stand. My receptionists have to wear masks. I've been wearing masks and scrubs for the last few weeks now to see patients, just for my own personal safety. So a lot of the way in which we do our practice has changed since the government did introduce health. It's meant we can do a lot of phone consultations and minimise people coming in for that face-to-face interaction. So we're able to fax script, send referrals, things like that, and try and do things more with less face-to-face kind of interactions.
Dr. Sema, how about you? I know that you're working in a emergency department, so definitely things has been challenging, to say the least, in the last couple of weeks.
Yeah, for us in the emergency departments, it's been a very dynamic time. I would say things are changing day to day, from shift to shift, essentially. We've moved from doing testing in the departments to doing testing in fever clinics. We're now trying to set up segregated areas for respiratory and non-respiratory patients and develop protocols for when we have a higher influx of COVID-19 patients. We are getting the patients, but not all at once, thankfully, because of all the measures that have been put into place. Again, for us, doctors have been donning personal protective equipment for patients with respiratory symptoms, whether they're confirmed or suspected COVID. And we are now masking for every patient. So the whole shift, if you go to the emergency department, you'll see the doctors and nurses have masks and goggles on for our own protection. But as I said, it's very uncertain times for us too. We're just trying day by day to pick up the information that's coming down from the government and the health authorities and implement it into our practices.
How's the personal side of your experience coming to the COVID-19 and working in the emergency department? Do you feel more afraid now that to be infected? Does the fear of getting COVID-19 treat you more seriously on a professional level, knowing that you are facing more cases?
Yeah, I think young doctors don't often have to think about their own mortality, but this is a situation in which we have to do. We have colleagues who are passing away regularly in Europe, young ones and old ones. So this is a situation in which the first time I thought perhaps I should write a will. But I think the anxiety is palpable. It's palpable in the community, and it's also palpable in the medical community. We are just like anyone else, humans, and we are at the coal face of it all. So we oftentimes are not worried for ourselves, but worried for the people that we live with, the people that we love, and taking the virus back home with us. So a lot of our anxiety is about how can we prevent an infection or carrying an infection back home.
And I think the same goes for you, Dr. Umber. The same fears and the same concerns that you carry with you on the GP every day.
Yeah, absolutely. Despite us having quite strict screening measures to make sure people with respiratory symptoms don't come to the clinic, we still manage to have people who come in, which is why I've had to wear masks. I wear masks all the time now at the clinic, and which is why I've changed to wearing scrubs so I don't take any infection back home.
So are people more afraid these days to come to the GP in general? Like, do you feel that people are taking more precautions and try to avoid coming to a GP unless it's really necessary?
Yes, definitely. So a lot of my colleagues who have businesses, including myself, have noticed that there's definitely a lot less patients coming in. A lot of them are trying to utilise the telehealth services, but we've definitely noticed a drop in numbers. And obviously the way general practice works is we are paid per patient. So if there's less patients, it does impact on a lot of us trying to run our businesses. So it's having impacts on multiple fronts.
I see. Okay. And Sema, for the same part, are people more afraid now to go to the emergency? I know that I'm avoiding going to the emergency department unless like it's really a life or death matter. So is this something that everyone is feeling at the same stage?
Yeah, I think that's true. I mean, there's a lot of people who often use an emergency department for quick access to medical care instead of, seeking advice from their very very experienced GPs like Dr. Umber, but we're seeing a lot less of that now. People are very weary of coming into the departments where they know there are sick COVID patients. And we still have the same population of people who have injuries, traumas, fractures, but we are seeing less of the people that I might normally see viruses, colds, coughs. They are staying at home where they should be self-isolating, socially distancing, and only seeking medical advice when they need to. So I think as we're getting a lot less of people who don't need to be in an emergency department, and that's exactly what we want. We don't want to be inundated with people. We want to be ready for an influx of unwell people when they come, and not with people that are just perhaps have a cough or cold or a mild fever.
Which I think brings a whole level of questioning on how educated are people when it comes to their health and what they should do about it. And in terms of going to the emergency, we know that a lot of people just go to the emergency department instead of going to their GP and just solve the problems on a smaller scale. But even now, people start going to the emergency department because they have a cough or they are afraid of getting COVID. So how people can be more confident of the choice they are making, whether going to the emergency department, going to their GP, what's the source of knowledge that they have to follow and avoid all of the myths and the stigmas that sometimes come with knowing or suspecting that you have a COVID-19?
So I think the government has released hotlines for you to call with your symptoms to be able to be guided into which direction you should be going. If you are acutely unwell, you should come to an emergency department and seek medical help. We're not saying that unwell people shouldn't be at the emergency department. But if you have symptoms that you're slightly concerned about, but you feel okay, you can seek help from Nurse on Call, from the COVID hotline, and get advice about where you should be going. Most emergency departments are not testing for COVID. The COVID fever clinics are testing for COVID. So you would be directed towards a fever clinic if you came straight to the emergency department for testing. The other thing to know is that not everyone, unfortunately, qualifies for testing. We have DHHS approved guidelines about who should be tested, and those guidelines are developed based on who are the at-risk populations of having COVID in Australia at this point in time. These guidelines are regularly updated. So if you come to me today and you have symptoms but you don't meet the epidemiological criteria, you won't be tested. But if you meet all of the criteria, then we would direct you to a fever clinic if you're well enough. If you're unwell, then we'd test you in the emergency department.
And Dr. Umber, for the people who are calling and checking with your GP practice regarding their cases, how easy is dealing with people's fear when they're afraid that they have the virus and they don't know what to do, or maybe they are in isolation and they're afraid to go outside? Maybe they should come to the GP for a different medical scenario. How you are dealing with people's fear in the situation and basically try to manage your patients?
So if you are worried you have coronavirus, we don't recommend you come to the GP because of the risk of spreading the virus. What we're actually doing is my receptionist screen the calls, and then we book you in for a telephone consultation, and then I'm able to assess the risk. And just like Dr. Sema has said, there's certain guidelines that we follow, and if you qualify for testing, then you'd be directed to a fever clinic. The GPs at the moment, most are not testing for COVID-19, but directing people to the closest clinic. So a lot of the time, the phone call is checking to see if that person definitely does need testing, and assessing over the phone how unwell they are, and then deciding if they're very unwell whether I need to see them in the car park because we're trying to stop them from coming inside, or whether I need to direct them to an emergency department. So that's how I've been dealing with it, and that's how a lot of doctors have been dealing with it.
And how is the support from the federal government or the Victorian government to your practices? I know they allowed now, or they made it more relaxed to do the telehealth appointments. So is there any other support other than that one?
So it was a big blessing that we were able to do telehealth. It was quite restrictive for the first week, so a lot of people didn't qualify, and then they expanded the eligibility. So most people now can access a telehealth consultation. In other ways, we have primary health networks that support GP practices, and they've dropped off small numbers of masks for us. So they've been supportive in that way and communicating quite well. So RACGP and the primary health and regular updates to us. So I get email updates almost every day with any changes to the guidelines. So that's how we're keeping up to date. And most of us are checking the guidelines a couple of times a day, because as this infection evolves, things will change. So we've got to stay up to date for it.
And so speaking of your patients, how is the COVID-19 impacting different groups of patients? We're looking at the elderly, which we know that the mortality rate is higher, but has that affected different groups in different ways, or it's almost normal?
I don't have any patients with COVID-19 as yet. So all I can kind of talk about is what's been happening around the world. So obviously we know that the elderly are more likely, if they are infected, have a higher mortality rate. But it still doesn't mean that just because you're younger that you're somehow magically immune and can't get infected. You can get infected, and the scary part is we don't know how our bodies would respond. Most of us would have a mild kind of infection, a fever, a sore throat, and we would recover. And then there are some of us, even though we're young and fit and healthy and don't have any of the comorbidities, our bodies may respond differently, and we may get really, really unwell, and end up in intensive care. And you can see that from around the world. There's a 13-year-old boy who died in the UK recently. There's a 6-week-old baby that died in the US. So age, even though we can look at numbers, we still need to take into account we don't know how our bodies can react. So we need to take it quite seriously, I think.
Dr. Sema, in the emergency department, I know that there are many changes now. So how is the government and how is the management of the emergency department these days changed in terms of procedures and protocols that you apply with the patients, and even internally? How do you manage the shifts and manage to cover all of this influx of cases that happened in the last couple of weeks?
Yeah, so as I said previously, there's been some restructuring of departments. Definitely in our department, we're working towards having more beds available, having respiratory pods and non-respiratory pods, so that patients with symptoms that could be COVID or other respiratory illnesses will be separate from everyone else. Again, separate waiting rooms for patients with respiratory versus non-respiratory symptoms. In our practice, on a practical level, we've had to be very careful about how we implement certain therapies for people because of the risk of COVID. So if you came in previously with your baby who had bronchiolitis and needed some airflow support, I could have easily given that baby high flow. But now I have to think about if that baby could have COVID, and giving high flow could put the whole department at risk. So we're having to use our negative pressure rooms a lot more. We're having to decide which patients need which therapies and at what time. That's more at the forefront of our mind now because of the risk of COVID. This is unprecedented for most young doctors, and even our bosses have never been through a pandemic per se, and haven't had to deal with changes to this scale before. So it is a learning experience, and there's definitely a learning curve for all of us. But thankfully, we have protocols in place as hospitals and codes in place where we are able to, upscale beds and departments when necessary for natural disasters and things like that. So a lot of that expertise from the management side is being used, I think, to be able to upscale our services for the possible influx of COVID patients.
Thank you so much. For our guests, I'd like to remind you that if you want to ask, you can put your questions on the group chat. If you are listening on Zoom, or if you are streaming on Facebook, then you can ask there, and we are collecting the questions, and we'll have a Q&A at the end of this session to ask our guests your questions and hopefully get the answers for them. Speaking of now, going back to your personal life, how do you cope with all of this? What is the mental impact on having a pandemic for the first time impacts you in personal life. You talked about how you are more afraid now of carrying back the disease to your house. But in the overall community, there is a huge sense of impact due to the social distancing, and some people are actually finding hard to cope with the new rules that you cannot see other people. Some people, you can't see your family at one point. How do you feel on a personal level that impact, and how do you cope with it?
So from our perspective, I think, and Umber would agree as well, as I said previously, we have a lot of anxiety about taking the virus back to our children. I'm not sure if Umber's done the same, but we've had to limit the interaction that we ourselves and our children have with older childcare providers, such as their grandparents, because of the fact that they are at risk of contracting the virus and potentially being asymptomatic carriers. So it's hard for me to comfortably allow my mum to see the baby now, because she could be at risk of catching it from him. So we've had to put family limitations in place on top of the restrictions that the government's already put in place, which is difficult for us. I personally will socially isolate between all shifts for fear of giving the virus to someone else in an asymptomatic period, unless it's absolutely essential that I go out. I'm sure Umber's been doing the same.
Yeah, definitely. I've had to, my children haven't seen their grandparents for the last 4 weeks, so I've kept them away. And for the same reason, my husband's also a doctor. So either of us could bring the infection home, and then the children, if they're the grandparents, could potentially spread it. And it's very real for me. I mean, my husband was feeling unwell a couple of days ago, and recently got tested for COVID-19, and thank God he's negative. But it's very real for us who are in the medical profession, because we're kind of, we're seeing it. We're having to send people for tests. We're having, people we know getting tested. So it's definitely quite, to be honest.
Just another thing, I think someone's asked a question about facing misinformation. That's the other thing we have to do as doctors. I mean, in this particular time, we don't take off our hat as doctors, unfortunately. We don't have much downtime in between our shifts either. So we're a doctor at work, and we're a doctor to our family and our loved ones, who often send us things and ask us, how true is this, or what should we be doing with this information? And a lot of our downtime now is spent correcting misinformation and trying to provide good information to our family and friends as well about the truth of how to protect yourself in this time. So for us, it's actually quite a tiring and exhausting period. We're working hard when we go to work. We're working hard at home to try and keep everyone well informed, and we're also quite socially isolated from our family and friends as well.
So the part with the information, how do you get the information these days? Are you relying mainly on the government's press releases? Are you looking into more wider medical community studies and documents? Because every other website now has their own medical expert who's bringing somewhat God knows what study, and start in some cases cause more panic than it should be. Or in some cases they say, no, it's nothing. So how do you, in the same concept, are we dealing, what are the sources that we should rely on for such information?
Did you want me to take this one?
Yeah.
Okay, so yeah. So we at work obviously are guided by the Department of Health and Human Services. So we have a lot of information coming through the department, who has the data to give us accurate information. And that's the information that we give to our patients and our family and loved ones. There's information from the World Health Organization, who gets data from around the world. Again, it's reliable, proven information with evidence. It's not just someone sitting at their phone on an Instagram Live talking about their experiences. This is worldwide medical community information. Information from the coronavirus app that the government has produced, again, accurate information. We have access to medical journals. The New England Journal of Medicine has published some of the Wuhan experiences for pediatric doctors to see what the numbers of pediatric cases have been like and the experience over there. So we have access to medical journals, and doctors in Spain, in Europe, in Italy, in China, through Wuhan, have published some of their experiences so that we can be guided by what they have been through. So a lot of the time when we give information to our patients, it's filtered down from really reliable sources. So I have been asking people to please be careful about where you get your information from. Double check the source, the credentials, make sure it's from a reliable website or a reliable source. And do not believe everything you hear on the internet and create more chaos and panic in this already very uncertain time.
Dr. Umber, you have a kid, which I think now see these changes and it might be confusing to him. How do you deal with that? How do you explain to your kids what's happening and why they can't see their grandparents for the last 4 weeks?
So I've got a 10-year-old and a 4-year-old. So the 10-year-old, he regularly calls grandparents, so he can do FaceTime. I try not to talk too much about the coronavirus and things like that at home. I don't want to create a stressful environment at home. I know a lot of parents have been trying to set up little classrooms and things like that, but what I've done is, it's school holidays, I've just made it quite fun for them. So they're just playing on their iPads, watching movies, and I think this is a stressful time for everyone. So I think we all need to just relax a bit and maybe take some pressure off of the children, especially work, studies and things like that. Even if it's for a week or two. That's just how I've basically been approaching it.
And speaking of kids, some questions that we got before the seminar, we're asking about, is it safe for my kid to go to the JB, for example, for vaccination or for a checkup? Should people still do these non-health critical issues? Should they still go to the GP or should they postpone it for the time being? What's your advice on that?
We're still operating and still seeing our patients, and vaccinations are extremely important, so we're continuing to give those. We're just much more strict with the cleaning of the rooms before and after, with hand washing for the adults that come in and the children. We've got hand sanitizer available in the waiting room. If it's for adult vaccinations, we've been trying to do them in the car park and running influenza clinics that way. So then everyone comes at a certain time, and then we can just have a trolley with all the vaccinations set up and do them outside. And it just means that people aren't coming into the clinic and risking potentially, if they've got asymptomatic coronavirus, spreading. So that's how we're trying to just keep it as safe and have minimal face-to-face interactions as possible.
So for those for people who want to properly do the self-isolation or the social distancing, there are a lot of discussions about this. And what's your advice in that regard, Dr. Umber, on social distancing? We know the rules, but how important is adhering to social distancing in this situation?
Yeah, it's extremely important because we know that there's some people, like we said before, who can be asymptomatic and still be potentially spreading the infection. So if you're going, often to the shops or going out often, you're touching surfaces and you don't know you have the virus, and then somebody else comes and touches that surface, they can potentially get the infection. So it's very, very important to prevent spread. So really only go out for essential things. And there's a difference between social distancing and then mandated self-isolation. So if you have been exposed to someone with coronavirus or you have it, you have to legally stay home, and there are consequences for not doing that. So people do have to take it seriously.
Okay. And Dr. Sema, how do you feel how do you evaluate the response so far from the people and the government on the COVID-19? Speaking as an emergency department, you are seeing the worst of cases, I think, at some times. So do you feel that the response has been adequate? Should some people do more in terms of social isolation? Should the government do more extreme measures to force people to social isolate?
So it's really hard to be critical of the government in such a novel situation. They are doing, I think, the job that they can do with the information that they have at present. And that's the same as your doctors in your emergency department. We are all doing the best we can with the information and the data that we have at present. We all have a responsibility. This is a time for the international community to come together and take responsibility for the health of the world, essentially. We all have a responsibility to stay at home, to stay away from people at risk, to only go out in really dire and essential circumstances. So I think what Jacinda Ardern said was very true. If you're unsure of how to behave, just act like you have COVID. So how would you behave if you had COVID? And that's how you should be behaving now. So some people still, I don't think, understand the gravity of the situation. I mean, I took my son to get vaccinated today, and there were still a lot of people shopping as families and things like that. I think they don't realise that if essentials are required, the whole family doesn't need to go. One person needs to go. That minimises your risk. It's a risk minimisation strategy in all parts of the society right now. We can't bring risk down to zero, but we can do everything we can to bring it down to a negligible level. And that takes a lot of effort from everyone. So we need to stay home. We need to practice strict hand hygiene. We need to protect our vulnerable and our elderly. So I think people are trying really hard, and we can see that from the numbers that we're getting in terms of the cases that are testing positive. But there's work to be done, and we can't just relax now and say, you know, our curve is flattening. There's a lot of work still to be done.
Which was my question. People are saying that somehow the curve are flattening, or actually the cases every day are reduced, the new cases. Should people, but so some people think that now it is time to relax the rules. Is it that time, or are we still didn't face the worst in this case?
Not at all. It's the opposite of that time. Like, we need to be working harder now than before. Any false sense of security that we're getting from reduced positive tests can be mitigated straight away if people start to relax this by a big surge. And a big surge could be because people don't take things seriously and start to mingle in the community, and then we get community spread, and then we will see the pictures that we're seeing in Europe as well. So really, now is the time to buckle down even further and take these instructions that the government and your doctors are giving you really seriously. Nobody makes these restrictions lightly. I can tell you that much. You can look at the economic impact of everything that's happening around us, and the trillions of dollars world governments are spending to be able to boost their economies in this situation. No government willingly restricts their citizens in the Western world usually. But in these circumstances, it is absolutely required, and it's our responsibility to take ownership of our health and the health of those around us by following those instructions.
Thank you so much. Dr. Umber, I just want to close with you before we take the questions. How do you find time to take care of yourself and keep your career going on? We know these are challenging times on both personal and professional levels. So how do you find the balance on keeping up to date with the latest developments in the medical world and making sure that whatever plans you have is not derailed as a result of this change that has affected most of the people in the world?
I think it's hard to give you an answer. I'm not a perfect person. I try and take social media breaks. I think that's important. Every day when I come into work, I'll check the guidelines, make sure nothing has changed overnight. I'll check the new numbers for infections. So that's how basically we've been staying up to date. And we get regular updates we get emails regularly during the day. So there's not a lot of work I have to put into it. I just have to make sure I'm checking and reading constantly. I have taken a little school holiday break, so I haven't been working for the last week, and that was because I was finding it too stressful and I wanted to spend some time with my children. So I think we, as Dr. and Sema knows, we work hard, we spend a lot of time away from our family and loved ones, and sometimes you have to, when you're under too much stress, you have to pull back as well and realize, okay, maybe I need to take a little bit of time off and devote my attention and my time to my family. So that's what I've done at the moment. And I'm still here for my patients. Don't worry, I'll be back in a week and a half, so don't worry. But it's basically, if I look after myself, then I'm able to look after everyone else.
Of course, thank you so much. And Dr. Sema, do you want to speak to that?
Yeah, I mean, we try as best as we can to practice, self-care in our downtime as well, but we both have children, and I mean, being a female medical practitioner has its own intricacies as well. You know, you come home and you have your children to look after, and then you go to work and you have to be the doctor at work. So we don't get much downtime is the truth of the matter. And when we do, you know, it's about trying to stay up to date with all the information, but also taking time out to spend time with your children and your partner. And you know, I regularly FaceTime my family because I don't see them much anymore. Try to watch a movie here and there like anyone else, and just try to stay sane, really, in these really uncertain times.
It is a very uncertain time, and it is a very challenging time, and I'd like to thank you both. Before we go to the questions, we have a couple of questions here on Zoom. So the first one is from Alif. He's asking, have you been faced with misinformation within our community, and if so, have you tried to address it? I think some of that goes back to some conspiracy theories that we have seen lately related to 5G and this global government lockdown that tries to steal people. So have you seen people actually coming and saying, no, this is the 5G? Both of you, feel free to speak.
Go ahead, Umber, you take it.
I've definitely seen all those conspiracy theories. I've seen the posts regarding 5G. There's some idea that the rollout of 5G is linked to coronavirus. That is definitely not the case. 5G is non-ionizing radiation, so it's got nothing to do with viruses. There's all kinds of misinformation about treatments, like can get rid of coronavirus. That isn't true. There's no evidence to suggest that. There's a lot of theories around eating garlic and drinking hot water, and that will save you. I think it's very simplistic, and people like to hold on to simple and easy to kind of access ideas. So if you've got garlic at home, then okay, I might try that. There's nothing wrong with eating that. That's fine, but it's not going to protect you from potentially getting the virus. And we've got to exercise our common sense, and like Sema said, make sure you look at the source of where you're getting the information and the credentials of the people giving you that information. Just because they have a platform or an Instagram account or whatever, it doesn't mean they are a scientific authority on every single topic out there. So make sure you're investigating where you're getting your information from, and stick to reliable sources. Basically, that would be my best recommendation.
There is a question from Sarah asking, what further support does the government need to do for both federal and state to support health professionals and their patients? Is there any extra support, Dr. Sema, that you feel you can benefit from at this stage?
I think the government is trying really hard to figure out who are the at-need populations in this whole pandemic issue. I mean, it's trying to inject money into mental health, it's trying to inject money into healthcare, all while trying to prop up the economy and inject money into small business and people who are on welfare. So the government is trying hard. I mean, the government is a group of people at the end of the day doing what they can to work through this situation. So again, tying into that misinformation issue, a lot of distrust of the government and some understanding that the government has some malicious intent during this whole thing really boggles my mind, when you can just see how desperate some of these leaders are getting to make this, get their people through this. I mean, you just have to watch the Italian Prime Minister to see how desperate he is to get his country through this whole thing. So in terms of support, you know, thankfully we are a collegial community. In terms of doctors at the moment, we're working together. We're trying to support each other as much as possible. There's a lot of support within teams and within hospitals at the moment. But there's another question on there about support for people who might be in domestic violence or children at risk. And I think that is at the forefront of a lot of people's mind who work with these populations, is with these restrictions in social movement, people who are at risk in domestic violence or children at risk, and how will they cope? And I don't have an answer for that, and I'm just hoping that the measures that are being put in place, the protective measures, will be enough. And these are the kind of people that it's our responsibility to look out for, you know, as a society. So, you know, ScoMo can't really look out for every single person out there with his budget and his implementation strategies, but we can, your neighbours you can look out for, children at risk you can look out for, you can look out for people that you think need more help and ask for that help on their behalf if they're not willing to speak out about it.
And I think that's the next question. I'll build on that. So there's a same question, I think, coming from two persons. Akhtar is mainly asking, are we prepared for situations like what happened in Italy, Spain, in terms of having enough PPE, test kits, etc.?
So I think the situation in the European area is a bit different from the Australian experience as we see it now. Australia has had a widespread testing regime and has had some time to get ready before our community spread has started. Many of our positive cases are from returned travellers and their contacts, and contact tracing is still possible in that setting. We have had small outbreaks, pockets of community spread that are more easily contained. In countries like Spain and Italy and America, we think that community spread was probably happening before the restrictions started to come into place. And that's why we have seen their numbers just extrapolate. So are we ready? I think that we're doing our best. I mean, we are really doing our best. It's hard to be ready for the unexpected, but from what we can see and what numbers we might be expecting, the intensive care beds are being increased, more ventilators are being purchased. I mean, I'm getting this information just like you guys from the, Daniel Andrews and the health ministers when they give their daily updates. But in the hospital, we're also increasing our space potential. We're increasing our shifts. We're increasing the number of doctors that can be on at any one time. So we're getting ready. In terms of protective equipment, yes, there is a shortage. That's just the truth of the nature, because the world has seen a surge in the need for it, and perhaps there wasn't enough to start with. We weren't prepared for a pandemic that would need all of us gowning and gloving and masking for every patient that we saw. But I think there will be a bit of catch up, and then we should have, fingers crossed, enough to last us through the influx of cases.
Inshallah. Dr. Umber, there is a question from Harun Zhang asking about the influenza vaccination and if that increases the chances of being exposed to the corona. Is there any truth to that?
No, I've never heard anything like that. But there is evidence that people who had, in Wuhan, who had influenza and coronavirus had higher mortality rates. So it's very important to get the influenza vaccine. And I think there are some recommendations for the elderly to get a booster vaccine in 3 months, because the influenza vaccine, it lasts for, the immunity lasts for about 12 weeks and then it starts to wane. So if there's very vulnerable people in the community, we'd be recommending a second immunisation. Unfortunately, that wouldn't be covered by the government-funded ones, and that would be a private one. But there's, it's quite easily accessible in the community. If you can't see your GP for it, you can get immunisation at the pharmacy.
Thank you. And there is another question too, I think, from Sarah. She's asking about people who are coming from cultural and language diverse background, which might miss some of the information that the government is putting out. So how do you do that as a GP who see different people who are coming from different backgrounds, and how do you feel that there is a huge gap that the government should cover first, and how do you try to relay that message to them as efficiently as you can?
As far as I'm aware, I think the government is sending messages through SBS radio and different languages. So I think there's messaging getting out there slowly. How I do things in the clinic, if someone who doesn't speak English, I can organise an interpreter. There are some resources we can print out in other languages, and I do this regularly for all kinds of medical problems. And the same goes for in this case, really. But it's, yeah, I think our communities just need to take it a little bit more seriously, I guess, and not be too complacent. And that's my worry, that sometimes with all the conspiracy theories that people don't take it seriously, and then we can potentially have outbreaks within our communities because the advice that's been given hasn't been taken.
Dr. Sema, there's a question from Anab regarding self-isolation. Can you self-isolate from your family if you are living with other people in the same house? How do you do that?
Look, it's a tricky one. I think you can, but you need to think about the logistics of your household. You would need 2 bathrooms, one for everyone else, one for the isolated person with COVID. You would need a segregated bedroom. You would need people to be able to provide you the food, because you going into the kitchen and contaminating cooking surfaces is a danger. So it's a bit of a logistical nightmare, but it can be done. So we know that this is a droplet transfer infection. So you need to be specifically speaking to a person, or they need to pick up your droplet, touch their eyes, face, or you need to be in the proximity of that person for a couple of hours to be able to get the virus. So if you are quite isolated in a room with closed doors, with your own bathroom, and not touching surfaces of the common areas, then you can self-isolate in a house with other people, yes.
Okay. I have 2 more questions. The first one from Pinar. Is it possible to be tested positive again? And if so, what should you do in that case?
I think this is referring to reinfection after having an initial infection.
Yep.
So this is a very novel virus. We know coronaviruses as a family have caused respiratory illness before. We've seen it in SARS, we've seen it in MERS, and coronaviruses can cause common colds. But this novel coronavirus, the SARS-CoV-2 or COVID-19 one, we don't have heaps of information about yet. So we know that there are cases of reinfection. People who have tested positive have then recovered and tested positive again. So what that means for your immunity once you have the virus, how long your immunity lasts for, we're not entirely sure, but we do know there are cases where people can get infected more than once. And we know healthcare professionals probably get infected more than once when they go back to work after having the infection. Some of them, the European doctors, we've seen that with you.
And do they need to self-isolate again in the case they were infected again?
Absolutely. It would be the same protocol as if you've had it the first time. You would need to self-isolate again. You would be just as infectious, I would assume. I don't know for sure, because as I said, it's a novel virus. We still haven't got all the data about how this transmits and incubates and things like that. But if you have it a second time, you would have to follow the same instructions as if you had it the first time.
And there is another question from Phyllis asking on the rules of emergency department now. Is there any pre-screening happening on the emergency departments to isolate the cases with COVID-19 from, let's say, a broken leg or an accident patient?
Yeah, we have separate emergency waiting rooms now, so that our respiratory and non-respiratory patients wait separately. We have respiratory pods, as in closed off areas for respiratory patients and non-respiratory patients, for departments that can do that. My department usually sees respiratory patients in closed rooms compared to the open bays where we might see other patients. And yet there is screening definitely. When you go to the triage desk at an emergency department, they often ask you a number of questions, and we'll calculate your risk of COVID. And if you need testing for one, or if you are a possible case, they will write that in the handover notes to the doctors.
Okay. Dr. Umber, I think I have the last question here from Geralda, and it's mainly about how frequent and how regular the disinfection happen in your practice, compared with the regular situation. How often now the rate of disinfection and cleaning happens, which I think basically talks about how people should be confident in visiting the GP that they will not get the virus while they're there.
Yep. So our waiting room chairs are cleaned regularly throughout the day. All the door handles are wiped down every couple of hours by the receptionist. I clean the consulting room chairs in between every patient, and the beds. Obviously, I spray the beds anyway in between patients. So and I wash hands as usual. All doctors, we always wash our hands in between our patients anyway. And we're just making sure that the patients remember to use the hand sanitizer as well in the rooms. But we've definitely been taking the cleaning much more seriously. There's always a level of cleanliness anyway in any or hospital, but we've just basically lifted it to another level now.
Thank you so much. I think we're running on time now, so first I'd like to thank you both for your time today and the information that you shared. I'd like to have a final word from both of you, starting with Dr. Umber, regarding the overall COVID-19, what people should do and where to get information, and how to deal with this new situation that everyone is going through these times.
Yeah. I would just advise people, please check your sources, make sure you're sticking to a few that are reliable, and like Sema has already said, the Department of Health and Human Services has a huge number of resources and material for you to read. The World Health Organization is a great resource. There's the government WhatsApp group that you can access. So I would recommend sticking to that, and I would try and avoid listening to all the conspiracy theories. And I would also maybe ask people to call out the people that share that and spread misinformation, because it's already a worrying time. And I think people who are adding to that anxiety and fear need to be called out, and they shouldn't be allowed to spread this misinformation and mislead our communities. So that would be basically my advice.
Thank you so much. Dr. Sema.
Yeah, I think I just would like to reinforce that you need to stay home. You basically just need to stay home and protect yourself and your family as best as possible. Umber and I don't have that luxury. We need to go to work and we need to be able to provide this essential service for everyone else. But if you can, you should stay at home and make our job easier. There's been a lot of talk about flattening the curve, and that's about protecting our healthcare system so that we are not overwhelmed like they have been in Italy and in Spain. So instead of having 10 ICU patients at once, if we got one, we could manage. If we got 10 at once, some of those are going to die and we're not going to be able to provide the required healthcare for them. So stay at home, flatten the curve, take it seriously, wash your hands regularly. I've seen a lot of people wearing gloves to the supermarket, and I admire the fact that you're really trying, but you're going to contaminate yourself by taking those gloves off anyway. So just wash your hands with soap and water or hand sanitizer with greater than 60% alcohol, and stay home when you can. That's the best advice I can give you all.
Thank you so much, Dr. Sema and Dr. Umber, for your time today. And it has been a pleasure having you talking to us. And thanks for your audience, for our audience who came today and listened to us in this discussion. Hopefully you got something out of it. And keep tuned for the next session that we'll have next week on education. The details will be published soon on our Facebook page and our media outlets. Dr. Umber and Dr. Sema, thank you again, and
Thanks for having us.
talk to you soon.
Very much.
Take care.
Thank you.
Bye.
Bye-bye.